Around the world, there is a critical need to ensure that quality healthcare remains affordable and accessible to the masses. The National University of Singapore, or NUS, has been actively involved in research and practice, as well as training new generations of leaders in public health. In this episode, we meet some of the researchers and innovators who have played pivotal roles in ensuring Singapore is future-ready in the area of public health.
Border control measures have been tightened. Total COVID-19 infections in Singapore have crossed 20,000.
About 100 new COVID-19 cases have been detected in migrant worker dormitories.
COVID-19 is one of the biggest threats to public health in recent years. Many of NUS's alumni are serving at the front lines of Singapore's fight against the deadly virus. But that's not all. In the early days of the pandemic, students made room for migrant workers, allowing them to recover from COVID-19 in their hostel rooms. NUS's staff and students also co-developed meaningful activities to keep them engaged during their quarantine. On the research front, NUS invested $4 million to boost research and innovation in the detection, treatment, and prevention of COVID-19. Many innovations have since been developed. The COVID Pass, or C-Pass, is the brainchild of Professor Wang Linfa, one of the world's leading experts in zoonotic diseases, which are illnesses transmitted from animals to humans. The C-Pass is the world's first rapid blood test to detect neutralizing antibodies against COVID-19.
After you infect or vaccinate, you will produce many different types of antibody, but the functional one that really fights the virus we call the neutralizing antibody. The COVID Pass can be used in many different aspects of a pandemic, but number one was to detect this immunity.
With just a small blood sample, the C-Pass can do the job within an hour without the need for highly skilled operators and complex procedures. Researchers and clinicians worldwide have also found many other uses for this versatile test kit.
C-Pass was not developed just for Singapore. C-Pass was developed for the world. I think I'm most proud to see C-Pass being used to do all the way, right, from contact tracing, vaccine efficacy, and now variants. And how can we improve a vaccine, and how do you measure it? So my C-Pass-based platform is being applied in all of this.
It took Professor Wang and his team slightly over 2 months to convert the initial concept into a commercial product.
70 days from the COVID virus to C-Pass to prove it's working, file the patent, ring up the commercial partner to go for regulatory. So it was an incredible journey.
The C-Pass is available in Singapore as a private test at local hospitals and GP clinics. As Singapore transitions to living with the virus, the test kit looks set to take on an even more important role.
If you go to the doctor to do a blood test to check your health status, from now on, you can check your immune status against this COVID-19 virus. And it's not only your responsibility, but also it's your own benefit. Do you want to have another booster? And that if you want to do an informed decision-making, you have to take test.
Professor Wang is renowned globally for playing a leading role in tracing the origins of the SARS virus to bats in 2005. Over a decade later, he has made another groundbreaking discovery.
The SARS survivors vaccinated with the Pfizer produced the super immunities to protect them in future against SARS-1, SARS-2, potentially SARS-3, and all the variants.
And it's led him to develop a new third-generation COVID-19 vaccine that can protect against all future variants of the SARS virus.
First generation vaccine is against the original Wuhan strain. Second generation vaccine is against the variant. The third generation coronavirus vaccine, that's what we call 3G COVAX. If we're successful, we will reduce the probability of SARS-3 by a lot.
However, vaccines alone will not be enough to take Singapore safely through another pandemic. That's where the Program for Research in Epidemic Preparedness and Response, or PREPARE, comes in. Professor Wang is the inaugural executive director.
So then you basically can, extract that. The PREPARE program is early intervention and then response and control. The overarching objectives is really for capability, rapid deployment, and the talent, expertise all work together as a national program. I think that's the future.
Another professor, Freddie Boy, who oversees NUS's initiatives in the areas of innovation, entrepreneurship, and research translation, has also been doing his part to aid Singapore's fight against COVID-19. In the early days of the pandemic, this serial inventor stepped up to meet an urgent need.
That time was during the circuit breaker. We were rapidly running out of test kits, and in particular the swab. The Copan swab was the standard. And these guys were selling it at 10 times the normal price, from $2 to $20. Not only that, they need you to put a deposit and you get it in 6 months' time.
To deal with the shortage, he led a team to develop a new swab stick design.
At that time, there was other teams doing 3D printing. Elegant method, but when it comes to rapid production, it just didn't hold. So I went for simple injection molding that speed-wise we could achieve millions in a month or two.
The use of injection molding also helps to keep production costs low. Most importantly, the new design is safe for use.
The swab stick is very important. It looks simple as a stick, but in reality, for example, it pokes in and you sneeze and it breaks. It can be fatal. This one uses little fins. Width is thin enough to trap fluids in it and retain it, and solid enough so that it will not break.
Professor Boy and his team took just 4 months to produce the first batch of 1 million swab sticks. To date, over 40 million swab sticks have been manufactured for use in more than 7 countries and counting.
For Singapore, the important thing is that if we go through another pandemic, we know that we have no problem in this area.
Over at the Saw Swee Hock School of Public Health, researchers are using modeling and statistics to help Singapore's continuing fight against COVID-19. Since its establishment in October 2011, the NUS Saw Swee Hock School of Public Health has played a key role in fostering healthier communities in Singapore and the region. A multidisciplinary team led by Associate Professor Alex Cook has been using mathematical modeling to help Singapore during the COVID-19 outbreak.
Mathematical modeling is when we represent a complex system in terms of simpler components. It's a little bit like when you are building a Lego castle and you use little Lego blocks to do that. Each of the Lego blocks is very simple, but when you put them together, something quite complex emerges from it.
Infectious disease modeling was used to study how COVID-19 spread across the island. The basic reproduction number, R0, shows how transmissible the virus is to the general population.
If the number is above 1, then that means that the virus will create an epidemic. If it's below 1, then it will just die out naturally. The early Wuhan variant was probably somewhere between 2 and 3, and 1 is the level we want to bring it down to if we want to stop transmission spreading. We've got a little hypothetical population here with 1 infected case in the first generation of infection. So 1 generation later, this person infects 2, reproduction number is 2. This person infects 3, and this person infects 1 person. As you can see how the virus is reaching most parts of the population. By generation 6, everyone within this population had been infected.
Modelling has also proved to be a critical component in the formulation of government policies dealing with the recent pandemic.
We can lay out what might happen if we do X or Y or Z. Then that allows the policymaker to make a decision. Okay, do I like what X might look like, or do I like what Y might look like? The question that we've faced at different stages of the pandemic has been how to make border restrictions less onerous, yet maintain the effectiveness. So here we're considering having testing only on arrival and then at the exit of quarantine, where the quarantine is of different durations. By simulating thousands of passengers arriving in at different stages of time since they had been infected, we can try to quantify how many would be missed, so that we're able then to model what would be the effect of having repeat antigen tests throughout the course of a quarantine, and to use that to show that we think that the risk actually would only go up by a small amount by switching from 2 weeks to 1 week of quarantine. We need to recalibrate as we go along, looking at what does the most recent data suggest, and then see how does that mean that we need to change the modelling structure in order to accommodate that. It's quite nice to see that the policies that have been implemented prior to the recent relaxation, they actually are one of the many hundreds of scenarios that we looked at. At least in a small way, the models have helped to inform how the policy should be implemented.
Professor Cook's modelling research on non-communicable diseases will also have a significant impact on Singapore in future.
One of the major challenges that we'll be facing over the next 10 years is to move towards population health, from primary care to thinking about prevention of disease. So one of the things that we have been looking at over the last few years is the effect of cutting the daily intake of salt by certain amounts in the long-term impact on strokes and heart attacks over the next 50 years.
Research at the School of Public Health is continuing to gain momentum under the lead of its dean, Professor Teo Yik Ying. But translating research into policies that will significantly improve the population's health is not an easy endeavor.
If you have a strong piece of evidence towards perhaps the best practices or even good practice, such as having the ability to nudge behavior on physical activity, influencing people to eat healthily, reduce sugar intake, minimize sodium intake. The challenge is, how do I now influence the national agencies in Singapore around taking up some of these recommendations that we have found from our scientific study? For example, National Step Challenge was a formidable behavioral nudge in getting people to exercise more. But is it cost effective? Is this the best way of doing things? And that's where our health economist comes in, to work with Health Promotion Board to really perform a rigorous evaluation to see, is this cost effective or not? Because at the end of the day, public health is not just about prevention. It is also about this concept called value. What should I spend on such that it will produce the biggest impact to the health of the community?
Besides providing vital insights to help inform public policy making, professors at the Saw Swee Hock School of Public Health are impacting the region through their research and collaborations. Although COVID-19 has been dominating news headlines for the past 2 years, it is only one of many public health challenges confronting the world today. One important yet overlooked problem is antimicrobial resistance, or AMR. It's a topic that Associate Professor Su Li-Young has spent the past decade researching extensively.
We can think of antimicrobial resistance as the microbe's ability to avoid being inhibited or killed by drugs that are used to kill them. We take antibiotics for common bacterial infections when they don't work so well against them anymore, or in some cases they don't work entirely. The bacteria will still continue to cause harm to the human body that they afflict.
The prevalent use of antibiotics is a cause for deep concern.
We, in general, are dependent on antibiotics for healthcare, advanced medical treatments. In many countries in Asia, you can buy antibiotics off the shelf in pharmacies without a doctor's prescription. Antibiotics is tied with how we produce our food. The fact that we have so much cheap and plentiful meat is because we are able to farm animals in close, cramped conditions, and by giving them antibiotics that promote their growth or prevent disease, these combined have resulted in the rise of drug-resistant bacteria and other pathogens in all parts of the world.
Drug-resistant infections are estimated to cause as many as 10 million deaths per year by 2050, with nearly half these deaths occurring in Asia.
Most people don't think about it because they don't see it, and until they are affected or their friends and families are affected by it.
See? You still insist that you need to see the doctor.
Hoping to raise local awareness of AMR, Professor Su co-produced The Antibiotic Tales with award-winning graphic novelist Sunny Liu in 2019.
Academics and doctors, we talk and it's like an echo chamber. It's not going to improve things until more people come up with different or more creative solutions. We need to try to decrease the use of antibiotics worldwide. At the same time, we need to encourage the development of new antibiotics because we will still depend on antibiotics for the foreseeable future.
The newly established Advancing Clinical Evidence in Infectious Diseases, or ADVANCE-ID, led by Professor David Patterson and Professor Su Li-Young, aims to be part of the solution.
So this is envisioned as a clinical research network in Asia that will try to tackle the big problems in infectious diseases, especially antimicrobial resistance. We intend to run clinical trials to test different types of antibiotic treatments in patients with severe infections caused by drug-resistant bacteria and find out how we can achieve better treatments for drug-resistant infections worldwide.
AMR aside, Professor Su's work also involves regional collaborations to deal with other public health-related issues.
So we have an office in Cambodia in collaboration with the University of Health Sciences in Cambodia that tackles problems like tuberculosis, HIV/AIDS, and more recently in chronic diseases and maternal and child health. We hope to set up a similar office in Laos soon. We do quite a bit of capacity building in the region where we run courses, one of which is mathematical modeling, which has come in extremely useful for the pandemics.
Professor Paul Tembaya, who works closely with Professor Su in ADVANCE-ID, also believes that regional cooperation is vital in combating public health crises. He is the first Singaporean to be elected as president of the International Society for Infectious Diseases, or ISID.
So ISID was actually set out with the long-term goal of promoting the study and research and development in infectious diseases with a focus on low and middle-income countries. The ultimate goal would be somebody showing up in a village clinic in Cameroon or in Liberia or Laos and being able to get the same standard of medical treatment that they could in Boston or Berlin.
The Program for Monitoring Emerging Diseases, also known as PROMED, is ISID's flagship program. It is an early warning system for infectious disease outbreaks. In fact, PROMED was the first to alert the world to SARS in 2003, and more recently, COVID-19.
It all began on December 30th, 2019. One of our deputy editors was receiving emails, messages from China, from people who were concerned about all the chatter that was going on in Weibo about an outbreak of pneumonia in Wuhan. There was actually a local news report, so she sent it out. That was the first announcement outside of China, and very soon after that, the rest of the world heard about the pandemic.
The largest epidemiological...
Professor Tembaya also heads the Asia-Pacific Society of Clinical Microbiology and Infection.
Ultimately, the goal of both societies is to raise the capacity in terms of infectious disease diagnosis, treatment, and prevention in low and middle income countries.
In the years to come, public health challenges will continue to test the health systems of nations worldwide. At NUS, faculty members are relentless in researching, innovating, and collaborating to develop effective strategies and solutions. Their aim is to empower not just Singapore, but the region and beyond, to tackle present and future public health issues and foster healthier communities.